joining us now from Westminster is the Health Secretary, Matt Hancock. Mr Hancock, good morning to you. The NHS front line is reeling from what is already happening and reeling at the thought of what may be coming quite soon. They are ill-equipped. They don't have the right equipment, enough PPE, enough masks, enough anything, and they're terrified, and many of them are now falling sick themselves. What reassurance can you give to NHS staff that you and your government are going to get them the protection they urgently need?
Well, you're right, Piers. This is incredibly important, and our NHS staff and staff in social care are going into work to care for people, and they've got to have the equipment that they need. So over the weekend, I've made sure that there's a shipment to each hospital of the protective equipment, the masks first and foremost, to make sure that people get that kit. And we've brought in the army to help make that distribution work. What's happened is, understandably, there's been a sudden, sharp increase in the amount of protective equipment that's needed. We have been delivering...
Late, though, Mr. Health Secretary, given that the World Health Organization alerted the world to a potential global pandemic at the end of January, given that we saw the scenes in China, we knew what was happening, why is this country and this government, I say this respectfully, so woefully ill-prepared in terms of the equipment we need to fight this virus?
Well, that's not the case, and I think you know it.
That is the case. I mean, literally, yesterday, all day long, doctors, nurses, consultants were hitting the airwaves, hitting social media, telling me appalling stories. I've got a friend of mine whose mother is in critical condition with coronavirus in a South London hospital. She said the nurses are absolutely desperate. They have very little protection. They're worried sick about themselves and about this avalanche that's coming their way. They don't feel protected. They're all telling me they don't feel protected. I don't think it's good enough for you to sit here and just say, actually, they are.
No, as you know, I wasn't saying that, and maybe if you allow me to answer the question, then I can explain to people who are watching this, who may be themselves getting ready to go to work in a hospital or in a GP practice, that getting the masks, getting the protective equipment to the front line is mission critical. It's what I've been working all weekend on, and as I said, we have distribution going out right now, and we've brought the army in. The reason that there's been a sharp increase in the need is, of course, suddenly there are many more cases of coronavirus. We have, of course, distributed this equipment before, and we've been planning this for several weeks. And there's been a sudden increase in the need for it, which is totally understandable and right. And what I've got to do is make sure that we get that equipment to the front line so that everybody on the front line has the equipment that they need.
We've seen this coming earlier, though, because, you know, we knew that it was going to increase, didn't we?
The other thing that I'm doing is making sure that there is a hotline, so that if you're on the front line and you don't have access to it, you can get on to us and we can get it out straight away. So yes, of course we knew that there was going to be an increase, but getting the distribution of this huge quantity of equipment right across the NHS is a very significant challenge. Thankfully, over the weekend we've distributed millions of masks, and I know, because not least because I've seen some of it, that distribution is happening. But we're constantly on this, because the point is this: if you ask people to go out and look after others and care for others, then we've got to make sure that they have the equipment that they need in order to keep themselves safe. If you really want to
care and look after the people who are doing the hard stuff and risking their lives for us, Health Secretary, why is the government doing nothing to lock down this country that bears any relation to what most other countries are doing? Why is it that Spain, that France, that Italy, that Belgium, that all these other countries around us in Europe are in almost total lockdown, and we are seeing these catastrophically stupid scenes all over the country of people piling into pubs last week where the Cheltenham Festival wasn't cancelled? We've seen all weekend people going out partying like it's a bank holiday, and still the Prime Minister stands at that podium and says, my advice is that you don't do this. People are not listening to his advice. They want clear direction, these people, because they're too stupid to make that decision themselves. We are risking lives, in my humble opinion, and by all means, tell me I'm wrong, but I think every day we are not locking down properly as a country, we are putting the very health workers that you're talking about at greater risk.
Well, I share your frustration, Piers. And over the weekend, I signed new laws to allow police to enforce the bans on pubs and clubs and restaurants. And as we've seen, the number of people not following the advice is incredibly damaging to the effort to stop the spread of the virus.
Given it's costing lives, and we all agree that, you agree that, the Prime Minister keeps saying it will cost lives, why is he not mandating it? Why is he not locking down the country? If that is now the strategy...
What I'm going to do is tell the people who are watching this programme what needs to happen. They need to stay more than 2 metres apart from people who aren't in their household. If that isn't followed, we are going to have to take more draconian action, as we've been prepared to. For instance, bringing in the police powers over shutting bars and pubs and restaurants. As Health Secretary, I am working every hour that there is to protect people, to protect the NHS and get the equipment to the front line, to make sure that everybody has the equipment and the protective equipment they need, to ensure that people know that they must stay apart from others who they don't live with to stop the spread of this disease. And that is what
Let's talk
I'm
about testing, because
only
literally 10 days ago, the Prime Minister, on behalf of the government, announced we were not going to be continuing any testing with anyone but the seriously ill in hospital. Why are we still only testing 8,000 a day when we were promised it would be 20,000, 25,000? What is going on with the testing where my co-presenter, Susanna, is at home isolating for 2 weeks because one of her family had a cough, may or may not have had it, and they have no way of knowing? The lack of testing is a massive problem, isn't it?
We are absolutely ramping up the testing, and I want to communicate to people the things that we are doing. My top priority of protecting lives is the basis of everything I do, including increasing the testing, which of course is critical, and making sure that I support my brilliant team right across the NHS and my civil servants in the department, all of whom are working 24/7.
Things about protecting them. Yesterday, we saw a scene at one of the Tesco's, where Tesco's brilliantly have opened up the supermarket for an hour for health workers, but all the health workers are going at the same time, creating a massive scrum. Why does it make any sense to have mass groups of people appearing in supermarkets all over the country, including specifically health workers for 1 hour a day in many of them? And the same question and logic applies to public transport. There are some horrific pictures this morning.
Well, of course, people in supermarkets should stay more than 2 metres apart.
Not.
Well, they need to, and as I've repeated...
Stop advising them to and order them to and make it happen. It makes no sense to me that you as a government say, just stay away 2 metres apart and everyone ignores you and you don't order it. Clearly, the advice is being ignored. If the advice is being ignored, the job of a government is to order it. As we're seeing... Look, if we were the only country involved in this, then I would say, OK, fair enough, you must know best. Every other country around Britain has locked down. Ireland, France, Spain, Italy,
and they're telling us to
They are all far more locked down than us,
France.
which prompts the question, what do we know that means we're not doing it, that they didn't get the memo on?
The measures that are being taken in Ireland are almost exactly the same as the measures that we're taking here. In fact, some of our measures are more stringent. So, and the point is that many of the countries that you mentioned are much further down the curve of the virus, meaning that we're able to act earlier in the progress of the virus than they are. And we are quite prepared to take more action if that is needed. And we keep that under constant review, and that is incredibly important for keeping people safe. Now, I want to see people following the rules because I want to protect lives, and the only way you can do that is by making sure
Stop trusting people who are clearly ignoring you. Stop trusting them, honestly. They don't get it. The scenes over the weekend were horrific. Can you remove all car park costs for all our health workers throughout this crisis at hospitals in this country?
Of course, I want to see health workers supported as much as possible. And I've just told you, I'm looking at this measure to see if there's a way that we can bring it in. And I entirely understand why people feel so strongly about it. What I was going to say is that many hospitals rightly have stopped visitors coming, because obviously we need to stop the spread of the virus, especially in hospitals, and that does free up car parking space. So it is something that we can look at, yes, and I'm very happy to answer that question.
I just want to ask about extra staff, because we've had 500 retired doctors, we've had thousands of nurses who've stepped in. There are those foreign nurses who are in this country. There's one in the US who's got more than 5 years' experience. She wants to be able to help, but that will take weeks and it will cost her over £1,000. Are you looking at waiving those costs to allow nurses, people who are perfectly qualified, to be able to help in this fight against coronavirus?
Yes, absolutely. And we're simplifying the rules to make sure that people from who are qualified abroad can work here. You know, it's all hands to the pump.
OK, well, listen, we greatly appreciate you coming on the programme. We wish you and the government all the very best as you fight this crisis. And let's just hope we get through it.
Yeah.